a very good evening. We welcome you to Health Port. Thank you so much for watching Church of Uganda Family TV. We are glad you're the reason we come here every single Friday. Yes, at 7 p.m. we are right here. And thank you so much, you who started with us from wherever we started from in the morning up to now. And Edrine Osteen Mukalazi is my name. Health Port is brought to you by Makerere University School of Public Health, together with Church of Uganda Family TV. And we look at early childhood development and maternal health. Yes, last week we were with Dr. Margaret Nakakeeto Kijambu. She was taking us through, because we know November is a commemoration of the World Prematurity Day. And because we are past 17th November, it's not that we keep quiet about it. We promised you we shall take a full month talking about prematurity. And last week we promised you to bring Dr. Nakakeeto back. We are glad she's back here with us. Doctor, we are excited that you're here even this evening.
Thank you very much.
Kindly greet our viewers and then we shall proceed.
Good evening, viewers. I'm glad to come back to the show.
Health Port, and share with our viewers.
Yeah.
Yes.
Because this is a great, and you know, when I talk about born too soon, I just can't stop unless you stop me.
We can just see that the love, the vigor when you're talking about them.
you just have to stop me. And just a continuation of last week.
So, Doctor, maybe to remind our viewers about what we looked at last week, about the commemoration of this day, in trying to create awareness of the challenges and burden of preterm babies. What is this burden? Is this burden on you, the health workers? Is the burden on the government? Or the burden is on the mother?
Thank you very much. The question, the burden is on everybody involved.
All stakeholders.
All stakeholders. The government has a burden. You remember last week I told you that these babies are expensive to take care of. So if the government, with our development partners, like UNICEF, WHO, Plan, what, if they have to provide equipment, one incubator is like 7 million, 9 million. And how many incubators can you buy? Ventilators, what? All the equipment is very expensive to keep the sick babies. So that burden is there on the government. They have to look for resources, and also they have to give us the right human resource. We need a number of them. In a right situation, we should have one nurse to one baby. But sometimes if you went to Kawempe, National Referral, you may find 100 to 120 babies, and they have only like 17 nurses. They should have 100, I calculated, they should have 109 nurses. I mean, rotating all through the shifts. But so there's a big burden.
And there is another one, you talked about constructing dormitories for the mothers.
For the mothers. That is there we have not started. Because the Chiwoko Hospital is a PNFP. So they constructed it. So there's a big burden. And most of now the government is changing the infrastructure to accommodate the baby. So it means we need money to construct neonatal units. Like a district hospital, they have had those small nurseries, which I'm talking about. So creating space to really have a neonatal unit, because we find that the district hospital, at any one time, they don't have less than 20 babies. So 20 babies in that small nursery, where the machines and everything, we can't. So that's already burden. And then the burden on the health workers. As I told you, the workload is a lot. Ideally, we should have one nurse to a baby. But you can find the neonatal unit has 20 babies, and because there are few, there may be 6 in the whole, and they have to rotate. One is off, another is on night, another is on day, and you find that there's one nurse, if you are lucky, 2 for 20 babies. Okay, so it is that's already a burden on the health system, a burden on the budget, and then the parents, it's a burden on the family, because they also have to put in the looking after a baby, a preterm baby, is more costly. As I know, the mothers have almost to feed the baby, because the baby can't take a lot of milk, the baby can't suck, the baby can't do it. At least if the baby can suck, the mother can lie down and put the baby on the breast. But then this one is being fed, the mother has to express milk. Sometimes the mother has no fridge that she can keep the milk for 2 days or 3 days. So every time she's going to feed, she has to express. And she's feeding almost every 2 hours. Every 2 hours, that is 12 times in 24 hours. And it is really, I remember a mother who gave her ordeal. She said, yes, I didn't lose the baby, but it is a task. I mean, the joy comes because the baby is there, but she could not deny that it was a very stressful situation. Mothers are awake. And then sometimes, the good thing with Africa or with Uganda, we have the social support system, because we have this extended family. But as I told you, when the baby is preterm, there's a lot of misconception, there's a lot of myths about the baby. Baby, as we said, you'll find a lot of separation. Yes, and then they separate, and she's left alone. And then, as I said, sometimes it's a young girl, maybe she got pregnant when she wasn't supposed to. And
she ran away from home. She came to her husband's room, and then the husband has left her in.
Yes, it's so many things. So it is a real hassle. And sometimes the mother, because of the stress, they don't have enough breast milk. Then you have to find, that's why you hear in Zambia we are trying to make a breast milk bank. So that we can have milk for such babies. Their mothers can't produce enough milk, and we have it's a big burden. We are still just growing into it. I know one of the planners recently, I'm fighting so many wars at so many fronts, and then he said, as a country, we are not about to have units or facilities at every level, at every health facility. So then I say, oh my God, we are not about. So when, So it's still trying to say, can you give us, I have been in some districts, and I asked them, what is our budget as a newborn? And they say, sincerely speaking, ours is under maternity from my mother. And then, but when they see, and you sometimes what I do, I take the managers to where it's an ideal. I used to work a lot, because they have a unit with everything, this whole system is well laid out. And when they come back, they say, oh my God, then they give us a budget. They said, we are going to redirect the budget. So those are the things I am working at, to see that people realize that we also need a budget of our own, because we have special needs. Yeah. We have our own way to go. So the burden is a lot on the budget, on the health workers, the mothers, the family. Your family TV, so you understand.
Yes.
The family is all on a burden to everybody. It's huge, but it is worth taking the steps towards achieving our goal of saving the babies.
From 2008, when the commemoration of this day started, up to this year, do you see? Have you registered any success? Has you, as the awareness creators, registered any success?
Oh yeah. I told you in 2007 is when we did the situation analysis for the whatever. So since then, we started. We were not as vigorous as now. We did not have this thing like a magazine. The magazine, this is the third issue and what. So as we grow into it and we get excited about seeing that we can do it and we can save. That's when I go mentoring, and the midwives look at it like it is impossible. This one baby, 800 grams. They have saved 800 grams babies. And I always, I usually say prayer to God. And I say, just bring them something challenging, a baby who is challenging, and see them, take them through.
Isn't that a prayer of doom?
No. It is, that's why I said, take them through and the baby survives. Okay?
Oh, and the baby survives
afterwards. And the baby survives. That is how they gain the confidence. So they will save many others. Because I saw the word fear. You know, you look at this baby. It's not only the mother who thinks that the baby is not going to survive. Even the midwife. She looks at this baby. The nurse looks at this baby. Even the doctor. The medical officer looks at this baby. For us, we have been so much in it that we see it as okay. But I remember one of my professors, my teacher, he was a physician. And we used to work on it. And then he used to tell me, but how do you hold those babies? He is a professor, but he's a physician. He's an adult physician. And you couldn't imagine holding that tiny little thing. But he's a health professional. So each one, those babies, you look at them, where the beginning is like, you look at this, see, this is helpless, this is hopeless. But as you work with them, you realize that there's hope. And once there's hope, you've got an extra mile and you do everything.
So in other words, your task is preaching hope to the midwives in the first place.
Yes, to the mothers first also.
Because I thought it starts with the midwives who are going to receive this baby.
The mother has to believe, because if the mother knows that my pregnancy is 7 months and it happens at home, and no hope that, or doesn't know that somebody will save it, she won't come.
That's true.
How will I dig her from the village? So we start with the community, telling them, now we can save this baby. That's why I told you that we can have peers, the mothers who have gone through it, and they show their babies. Actually, on this commemoration day, we bring mothers who have gone through the units, and they come with their babies at different ages, and they give testimonies. And some of them, even when I call in a mother, there may be a mother who has lost hope, and even with the health workers, we can't give her hope until we call in a mother who has gone through it and the baby is alive.
Like we shall also do.
Yes, please do that. And when the mother shows this one and tells her, I usually tell the mother, tell her you cried. Because sometimes they leave out those. Because the mother...
So they should not speak about only gold.
Yes, I said, tell her you cried. Because they said she would they cry and they have lost hope and what. But the baby now has grown. And then they come and they give them hope. And they say, you just do what the doctor says. Because we were also the same way. But we have seen when mothers in the units, we put a tube to feed, as I said. And then the mother doesn't want the tube because it is foreign. It is like when they told me to put on a mask, and I walk on the street with a mask. It's not the normal.
Yeah.
And so this mother says, no, that tube is going to kill my baby. It's going to do what? So you have to bring another mother whose baby survived on a tube. And then she tells, no, let them put. And I've realized when such things, when you put the tube, and then the mother, you tell you are independent, you can feed the baby will get enough, because here someone is pouring, because the baby can't swallow, because these small babies, the swallowing reflex is very poor, so a lot of milk just spills, so they won't get enough, so they won't grow. So when they are really small, 1 kilogram, 1.2, we have to put a tube. And then she expresses, and we teach her how to feed through that.
So a mother should know that that is normal.
No, that is normal
to that baby.
For that baby. Okay, so those are the things we sensitize them about. So that is normal. So you give them hope, and then you give the health worker also sees you. So we do on-site mentorship. We who have gone through it, we go and work with these midwives and nurses on site, and we work with them, and then it's, yeah, you are touching them. Then, but eventually they also learn, and then they can.
Some of them fear to touch this.
Yes, but they grow into it. And we have registered a lot of success, because as I speak now, I think in North Acholi region, we have established units at all the hospitals. West Nile, all the general hospitals have, and regional file, they have units independent and working and saving babies. Now I've just come from the Rwenzori region. We have in Kamuli, they built a big neonatal unit.
Doctor, when we come back after the commercial break, you're going to tell us why you had to carry the commemoration this time to Kasese and not anywhere else. We are coming back shortly after the commercial break. Stay on Family TV.
COVID is a pandemic, and is a terrible disease. This thing kills in days. We should take everything it takes to prevent and avoid getting it. Like washing hands. What do you have to pay to wash hands? Put on a mask, distancing. And if you are not attending a function, you are not attending a burial, will not stop that person from being buried, then don't go. And it's good we are in a digital era. We send money as condolences to the people concerned and say, we are sorry, we cannot come, the situation. As simple as that. Our culture requires us to socialize, be near somebody and console them. Yes, correct. But the situation prevailing at the moment doesn't allow. These are simple matters. But we take it simply. You have to wait for the police to remind you, people to run after you. But life is yours.
Protect yourself from COVID-19 by washing your hands with soap, wearing your mask, keeping your distance, getting vaccinated, avoiding crowds, staying at home, and avoiding shaking hands and hugging.
Welcome back from the commercial break. This is Health Port. Health Port is brought to you by Makerere University School of Public Health. Together with Family TV, basically looking at early childhood development and maternal health. Edrine Osteen Mukalazi is my name. I'm with Dr. Nakakeeto Chijambo. And we are still having a talk on the World Prematurity Day. Doctor,
yes.
Why did you have to carry the commemoration of this year to Kasese and not anywhere else in Uganda? Is it because it has the hills? Is it because it has,
Yeah, we could say the national park is
exactly.
there, and we want to visit, but
it has a copper mine.
Oh, wow. The Kirembe copper mine
Yes.
failing, You heard about that disaster? But we went to Kasese because we have been, 2008, we have been to different areas. And actually we had not, apart from one time we were in Hoima, but we have not been engaged in the east so much. We have been to the northeast, is it northwest? Northwest. That is Arua. One time we celebrated there, we celebrated in Lira, so we are just moved. We celebrated in Busia, we celebrated in Kamuli. Now it's time to move this in. And also, sometimes we get somebody to offer to host the district and the implementing partners, because districts have implementing partners. And the implementing partner also has to agree to host, because it involves also money, this commemoration, making this. I know others also contribute. So Kasese was like, when we moved to the West, we said, where do we go? And we had just did the mentorship there. And we now, Bwera Bwera District Hospital is the one for government in that region. We had opened their unit, and UNICEF had given the equipment, and we had started training, and they're all excited and what. So we really take where we have achieved. When we went to Kamuli last year, now it was Kamuli, they had just built this new unit, plan was in Itmaj, we had all the health center force, they had put small units, and what. We have to go somewhere where there's something to show, and give us the others who come to see, to commemorate the day. It is possible, these ones have done it. It means we can do it. So we don't just go there and eat and drink and what. Yes, but we need to have something to show of success. And that's why I told you, we since 2008, we have really moved strides. And one of the other things which has been bothering us, so that we are not getting it, is the data. People, as I told you, they are hidden in the postnatal, the mothers, what. So all the registers babies were registered in the mother's register. But now we have also created our own registers. We are really coming up. Now we are independent. And we have our own registers, so we can track. And we can account for every baby, where they are, especially once they reach the hospital. And we are moving now, as we establish at different regions or different districts at different levels. Where we started from, we are moving to the community now. We are getting to involve the village health teams as the community health workers. How can we, when you discharge the baby, as I told you, we may have the baby for 2 weeks, but the baby is still low birth weight. So they need a structure in the community which can help them. And that is, I know School of Public Health, they do a lot of those community surveillance programs. And we learn from them, and then we go to implement them. When they do the research, they bring it to us, we implement it. So we are using, the government has that structure of the village health team. And there's the village health worker is the one we train, we want to follow up and support, especially those who have run into the problem with the husband separating and no social structure. The village health team has to support that mother and ensure that we teach them the danger sign, what is the danger sign in the baby, and make sure that they are doing the KMC, keeping the baby warm, make sure the mother is getting enough breast milk for the baby, and making sure that the baby is not sick and what, making sure hand washing. I was happy for Corona to come because now people can hand wash, people can sanitize, people can put masks, because we needed those even for when we are caring for the very small babies. So that you don't infect them, because their immune system is very low. So that's, as I said, we are trying to create that continuum of care. That even, and then the other thing which we have done, because as I said, they are in the hospital maybe 5 days, 2 weeks, we have created a system whereby we have a follow-up clinic at every center. And we are saying at the KMC, just if the baby has no complication, Health Center 3 can follow them up. Just KMC, so that we don't burden now these people who have to deal with the critical issues, the specialized cases. They go to the national critical issues at regional, and the district hospital can really manage most of the other things.
Why among all the colors you chose purple? And secondly, why among all the symbols you chose a soap line as a symbol for this day?
Well, purple is our color, not like what. I don't know why people choose colors, but I don't
because
actually,
it is our color towards Family TV.
I've never thought about why it is purple. Fortunately, I love purple, that lilac, whatever. But I really don't know. I've never thought about it, but I found the color there, and we just move with that. I don't know. I don't know why people choose colors for whatever they do. Sincerely speaking, I'm going to find out.
Okay.
It's a challenge. Yeah, really. I've never thought about why it is purple, but
because we would think of pink or white or any other fancy color.
No, pink.
Like the babies would love to look at.
At pink.
No, like those colors that mothers always buy, clothes that mother always buy.
Maybe to be neutral, because they buy blue for boys and pink for girls. Let's have purple, which has nobody.
Okay.
So that is like neutral color. But no, that is my thinking. But
what about this sock line? Because it must be carrying a lot of message.
The sock. Now you see we have the warmth. You know that is knitted. How do I put it? I think it's for warmth. Really, I've never bothered to find why they chose those particular
symbols.
The symbols.
Because a mother out there would look at a poster having this sock line with stockings, a young baby's stockings being hung with a peg. And then they will ask themselves, why?
Yeah, but stockings, because we have to put our babies in a booty, a sock, and we have to put our baby with a cap. Because we always preach that. Even when they are skin to skin, we put the sock line. I think we need those booties to keep them warm. Have you ever noticed that once the feet are warm, you are warm?
Yes.
Because I remember in school we used to put our feet in water to make them cold, so we read. So once you,
so that you keep awake.
And they soak the feet and the head, especially the head on a baby's body, is the largest surface area. So they tend to lose heat a lot. And I'm sure even for older babies, the full term, when you see them, the heat rushes usually starts here.
Yes.
And because they have put on the cap, they don't even let the baby breathe the head. So for us not to lose the heat for the babies, the small babies, we put a hat and we put the sock, and they keep warm. Yeah. Okay.
So
that is just a scientific explanation. I don't know whether they put the sock, because
we need to look for the symbol designer to give us more details. Doctor, as we wind up, what is your last message to mothers who are having preterm babies? I know there are mothers who have already lost hope.
Yes.
Maybe they're not sure whether their babies will survive or what. So there might be a mother watching right now. Please speak to them a message of hope.
Mothers, there's hope. Every baby, as long as they come out breathing, just take them to the nearest health facility, because we are also advocating we are giving skills to those babies, to those nurses. Yes, the nurses and the health workers. At least what we tell them, they may not treat them at that point, let's say health center 3, but we have put their equipment to make sure they can stabilize that baby for transportation to the next level where they are supposed to be treated. But most of the time, a small baby who is like 1.5 and above can be managed even at health center 3, because it is basic care, KMC, feeding, and keeping the baby warm, keeping the baby dry. So there is hope. Please have hope in the system. We are creating the systems, and I'm sure for those who are seeing me and went through our programs, you are seeing that things have improved a lot. And also for the health workers, at whatever level you are, you can do something to save this baby. And we are here, we are coming to give you more skills, and we shall be there. And our managers, please listen to us. Please give us put us in the budget, and we make sure that we provide the right environment, infrastructure, and equipment for the babies born too soon. Thank you very much for listening to me.
Wow. Zero separation, act now. Keep parents and babies born too soon together. Thank you so much, Doctor. We are grateful. And thank you so much for this time. And to our esteemed viewers, thank you so much for watching HealthPort. HealthPort is brought to you by Makerere University School of Public Health together with Family TV. Edrine Osteen Mukalazi is my name. Yes, we are still on the journey of prematurity. And we shall see, or you will see, what we have for you next week. Just keep your eyes on Church of Uganda Family TV. But as of today, I've worked with Jonah Jah, the producer, and Brenda Tijakira. In transmission, there is Bantam, and on social media, there is Tony Santo. God bless you. Have a good night and a blessed weekend.